started. Welcome, everyone. I'm thrilled and excited to have all of you join us for tonight's webinar. It is part of our coalition effort to pass hundreds of local resolutions in support of Medicare for All. And my name's Melinda St. I'm the campaign director for Public Citizens Medicare for All campaign, and we've joined together with many powerful organizations that as part of a coalition effort to pass these local resolutions, because we all believe really strongly that healthcare is a human right. And it's truly exciting, the gains that we have all made, that we've been making in our communities all over the country. Over the summer, we had some exciting victories, which we will celebrate tonight. We had Chicago's Cook County passed a resolution, Carpinteria, California, Norristown, Pennsylvania recently passed a Medicare for All resolution. And many of you and activists around the country have laid important groundwork for these resolutions and have organized people's assemblies, and you've built pressure on members of Congress all throughout the August recess. So now summer's over, and Congress and city councils are getting back to work, and so we're really ready to kick this campaign into high gear. Yesterday, we heard the stunning news that Congressman Hakeem Jeffries from New York, who is potentially in line for Speaker of the House after Nancy Pelosi, just signed on as a co-sponsor of the Medicare for All Act of 2019, which is very exciting. It was a huge victory for the Brooklyn Coalition that's been mobilizing in district for a long time, and especially in August. And it also shows that the political winds for Medicare for All are really continuing to gain momentum. And I also want to point out that the map that we have on MedicareForAllResolutions.org has continued to grow. We now have more than 180 local efforts to pass local resolutions all around the country on that map. So extremely exciting. We're going to be hearing from some of the amazing local leaders who are making this happen on tonight's webinar, and we are going to give you a preview of our coalition's plans for a Medicare for All Resolutions Week, a week of action at the end of October. So we will be sharing a link for you to learn more about the week of action, and we'll be talking more about that later in this webinar. But I want to let folks know we really hope that you'll join us during our week of action. We'll be telling you more about that. But first, I'm thrilled that we are going to be joined by some really exciting experts at the national level. We will be joined by Congresswoman Debbie Dingell, who is one of the two authors of the Medicare for All Act of 2019. I don't see her on yet, so we will keep our eyes peeled for her and have her join as soon as she can. Obviously, she has a very busy schedule. And then we're also thrilled to have other experts from our coalition. Nancy Altman has joined us, and she's the president of Social Security Works, and will be giving us a presentation about how Medicare for All will benefit seniors currently on Medicare. And we also have Jen Kimmich, who's a business owner who's active with our coalition partner Business for Medicare for All, to help talk about the business case for Medicare for All. So because we don't see yet Congresswoman Dingell, Nancy, if you'd like to get us started, that would be fantastic. I'm really excited to welcome Nancy Altman, who is one of the country's foremost experts on Social Security and pensions. She's the president of our partner organization, as I mentioned, Social Security Works, and she serves as an appointee on the 7-person bipartisan Social Security Advisory Board, which is an independent federal government agency that advises the president and Congress about Social Security. So Nancy knows quite a bit about how seniors will be affected by Medicare for All, and we know that industry and even the current president has tried to spread fear about Medicare for all and how that might hurt seniors currently on Medicare. And so we really want to know the facts here and how we can talk about them. So we're really excited to have Nancy share some words with us. So welcome, Nancy.
Thank you so much, and thank you everyone for joining. And please, when Representative Dingell comes, feel free to cut me off, and because I know she's got a busy schedule, and we can turn to her and return to me. But let me just pick up on what Melinda was just saying to us, and that is that opponents of Medicare for all have really, the only tactic they have is to scare seniors that they have something to lose. So it's really important to understand and to communicate to everyone who is currently on Medicare that they should be the strongest supporters of Medicare for all. They have an enormous amount to gain. Medicare is extremely popular. It's been extremely, it was enacted in 1965. It's been very popular program. And I think what it's important to emphasize is that Medicare for all will improve current Medicare for current beneficiaries and then extend it to everyone. And it can improve it because of the efficiencies that are gained by covering everyone and having a universal single risk pool. So let me start by the way that it's improved. Long-term care, we don't really have a solution to long-term care these days. Medicaid has become the default program for Medicaid. It was not intended to serve this purpose. It's supposed to be for low income. But what seniors and their families find is that they really have to impoverish themselves when they need long-term care. Long-term care can cost, it costs on average about $225 a day, or $82,125 each and every year. Very few people are wealthy enough to be able to afford that on their own. But the Medicare for All Act of 2019 covers both in-home care and institutional nursing home care, which is huge. It's something, those are costs as we have an aging population that are going to grow. Most people want to age in place if they can. We want to have the right incentives so they can do that and the right supports. And Medicare for All has that, and it also extends that to institutional care. So that in and of itself is huge. It can provide all of this and still save seniors money. Social Security has very modest but vital benefits. But because healthcare costs keep going up, which means Medicare premiums go up, out-of-pocket costs go up, more and more of Social Security dollars are going to Medicare, which means an indirect cut to Social Security. On average, about 40% of Social Security beneficiaries' Social Security benefits have to go out in prescription drugs, for health care, and for premiums, copays, deductibles, and so forth. What the Medicare for All Act does is free seniors from all of those expenses. It's basically a boost in their Social Security benefits because they don't have these big expenses. The costs are spread across the population. Another big advantage of Medicare for All is that there are no networks. So you have complete choice about what doctors to go to, what hospitals to go to, what referrals to have, what specialists when you're in need of a specialist. You know, a lot of opponents of Medicare for All go, oh my gosh, people lose choice. It'll be exactly the opposite. Seniors and everyone else will have much greater choice because we won't have these in-network, out-of-network issues that we have now. Everyone will be in-network. In addition, the Medicare now has some gaps. It does not cover vision, hearing, dental. These are extremely important services. Hearing in particular can lead to falls and vision as well. They can create all kinds of medical problems. Dental problems can really result in malnutrition and serious other health ailments. So these are all extremely important benefits, which we don't have under Medicare for one simple reason, and that is that we pay overall for our health care about twice in terms of percentage of GDP of every other industrialized country. And of course, we don't cover all our citizens the way they do. We have less good health outcomes. And the reason is that insurance is most efficient and effective when you have the highest risk pool possible. And it's only the federal government that can require everybody be in a single risk pool and can have none of what's called adverse selection, where people can, could wait until they're sick and then opt in. Obviously, that is a very expensive way to run healthcare insurance. With Medicare for all, where everyone's in a single risk pool, it is very efficient, and we will gain the kinds of savings that other countries have. A lot of opponents of Social Security, of Medicare for all say, and they're often opponents of Social Security as well, so it's a little slip there. But a lot of them say, oh my gosh, this is gonna raise your taxes. How much is this gonna cost? I think the right question to ask is, how do we divvy up the savings? This is gonna cost so much less for Americans out of pocket that the real question is, how much does business save? How much do individuals save? And so forth. So, as I say, it's very easy to scare seniors and people with disabilities, who are the current Medicare population, are the ones who have the largest, on average, healthcare costs. Healthcare is very frightening to people because you want to make sure that if you have a life-threatening illness or accident, you can get the care that you need. Many people are hanging on until their 65th birthdays when they can get Medicare. And once they're on Medicare, it's very easy for demagogues like Donald Trump to scare them and say, oh my God, they're going to dilute it and weaken it. And I think the important message is that it will gain strength in a number of ways. First of all, it will be much more cost efficient, which will lower their seniors' out-of-pocket costs. It will also extend the benefits that seniors get, including the invaluable benefit of long-term care. So it really is a winning formula. And the other thing is that once you have Medicare and Social Security are very politically strong, because you've got 63 million people receiving Social Security benefits every month, their families and so forth, and you have similar numbers of people receiving Medicare. And politicians know that they tamper with that at their risk. So just imagine if all of us were in one system, that would create even more political strength. So let me conclude with a point about history, and that is that Medicare was always intended to be simply the first step towards Medicare for all. In 1935, President Roosevelt almost proposed universal health insurance guaranteed at that time, and decided to wait because it was such a big lift, along with Social Security and unemployment insurance and so forth. He was going to pursue it in the early 1940s, but then we entered World War II. He then died, and President Truman picked up the mantle and tried to push it then. And they were unable to get it through, so they decided to try to do it incrementally. So we started with Medicare in 1965 for seniors. Medicare for people with disabilities was added in 1972. The thought was we would add a Medi-Kids program, Medicare for children, soon after that, and gradually cover the entire population. Unfortunately, we had the Reagan Revolution and the conservatives that saw government as the problem rather than the solution, and we got off track. But I think this is a moment in history when we are getting back on track. And my own view is that seniors should be really leading the way, because seniors know better than anyone how valuable Medicare is and how important it would be for it to be, it would be valuable for them, it would be valuable for their children, for their grandchildren, and for future generations. So part of this fight is to enlist seniors and get them at the forefront of fighting for Medicare for all. Thank you.
Thank you so much, Nancy. We really appreciate you sharing your immense expertise with us. You may be able to see that there's a lot of interest and questions coming in on the chat that Dr. Bill Honigman has been answering. We really appreciate that, Dr. Bill from Progressive Democrats of America. Nancy, feel free to make it to fill. If you want to chat as well, that would be great. But we really welcome. Thank you so much. We still are waiting to hear from Representative Dingell. I really hope that she didn't get pulled away to something really important, but we are continuing to try to get a hold of her. But in the meantime, I'm really delighted to invite to speak Jen Kimmich, who is the CEO of Alchemist Brewery in Vermont, and who has been a powerful spokeswoman making the business case for Medicare for all. So Jen, if you could share some words with some of your insights with us, I think that would be great for our nationwide audience.
Sure. Thanks, Melinda. It's great to be here. Thank you. My husband and I started our small business in the state of Vermont 16 years ago. And I always like to tell people, I know what it's like not to have health insurance. The day after we opened, we had $300 in the bank, 8 new employees. I found out I was pregnant and I hadn't had health insurance for 10 years. And this was before the Affordable Care Act. So we quickly got to work to grow our business as quick as possible so we could get ourselves insurance and start to employ as many employees as possible. Today we have 48 employees. We offer full health insurance to all of our employees. We pay 100% of the premium. We pay 100% of the premium for their children, and we pay 50% for employees. And we do this for 3 reasons. First, we believe everyone should have access to quality health care. That's simple. But the second reason is really important. It's a really good business decision for us. It's good for our bottom line. When our employees are healthy and their families are healthy, our business does better. Their productivity goes up, their morale goes up. And the third reason we provide health insurance today to all of our employees is because we can afford it. And I say that because we could not always afford to provide health insurance to all of our employees. And there are many, many more small and medium-sized business owners that share the same values I do and want to provide health insurance to their employees, and they simply can't. And as you know, there are a lot of sole proprietors too that don't even have health insurance for themselves. So today, after all this years, 16 years later, we're spending over $400,000 a year on health insurance. That's not for all of our employees. We do have some employees who are on their spouses. We spend over $400,000 a year, and many of our employees still don't go to the doctor because they're afraid of deductibles. They're afraid of co-pays, out-of-pocket expenses. So it's really just a shame we have this insurance. Our employees still don't use it. Some use it, but they still spend so much out of pocket that we've actually had to set up a loan program here at work for people that do spend a lot of money on pharmaceuticals or have children and have a lot of out-of-pocket expenses. Replacing employment-based health insurance with the national single-payer system would be great for businesses and workers alike. It would be really great for our business. If our employees had health care as a right, we could focus on making beer instead of spending so much time and so many resources navigating and managing health insurance. And just to show you one example of how much time we spend navigating health insurance, we recently came up with a 10-page questionnaire for our employees. It's anonymous, and a young woman who works here in Human Resources designed this. So we could figure out what our employees prioritized, what was more important to them, if they were using acupuncture or if they had children and they needed more preventative care, so that we would know what policies we could even offer our employees. So that's just one example of all the time that we put into navigating this. Also, if our employees had health care as a right, it would level the playing field for businesses, especially small businesses that struggle to compete with recruitment and retainment. You know, I think for small businesses that can't afford health insurance but want to, it would be great to level the playing field for them, because there are a lot of larger employers that do provide health insurance. At the same time, though, what I see are a lot of large employers that can provide health insurance and don't. We have several employers whose spouses are on our policy, because our policy is better than their employers, even though their employers have more profitable and bigger businesses than we do. So there are a lot of ways it would level the playing field. And the third reason it would be really great for workers and businesses alike is health insurance just simply should not be tied to your job. We all know people that are stuck in jobs they don't like, they're unhappy, and the only reason they're there is because they need their health insurance, and they're just tied there. You know, as a business owner, if we're really serious about addressing the three fundamental areas of healthcare, access, quality, and cost, we really do need bold policy that supports a national healthcare system and universal coverage for everyone. Insurance companies just will continue to profit greatly on the backs of small businesses like mine and Americans.
Thank you. Thank you so much, Jen, Kimmich. I really appreciate you bringing your perspective. And I think for folks who are working to pass resolutions and their communities, connecting with small business owners and medium-sized business owners in your community and getting them as part of your advocacy effort can be very powerful to be able to, because they can have influence in the community. And I think the more that we can bring in the business voice, I think is going to be very powerful for as our movement grows. So thank you so much, Jen. Next, I am excited to invite some of the local leaders who have been active in their communities to pass local resolutions. And first, I want to invite Peter Kahn, who's from Carpinteria, California, who helped to lead a successful effort this summer to pass a local resolution. Peter, would you like to give us an update?
Sure. Can you hear me okay?
Yes.
Okay, great. My wife Pauline and I actually live in the city of Santa Barbara, which is about 15 miles north of Carpinteria. We've been volunteers with Healthcare for All since 2000, so we've been involved in this for about 20 years, which helped a great deal in putting this together. We had joined the coalition with Audie Barkin, who lives in Santa Barbara, in swinging our local congressman, Salud Carbajal, to sign on to 1384. And from there, we learned about the resolutions campaign and thought, well, we've done this before, maybe we can do it again. We contacted the city manager down in Carpinteria, and he remembered us from 15 or so years ago when we asked for a resolution of support for California legislation. He polled the council members, 3 of whom were on the council 15 years ago, so that made it easier. He put together a packet of materials. I provided him with some materials, and he added pros and cons to the agenda item for the city council to consider it. And they voted 5-0 for adoption. Paulina and I and one of our Healthcare for All members who lives in Carpinteria gave 3-minute public comment speeches. So it was It was a very nice experience. The councilman and city manager remembered us and the issue. They were interested. They passed the resolution. A draft resolution for support was presented to them, and at the second meeting, they voted positively for it. So the resolution was sent then to Representative Jayapal with copies to our congressperson and to Senator Feinstein. If there are any who are on this call who are just starting, please never give up. Major social change usually takes time and advocates willing to patiently keep learning, pushing, and staying involved.
Thank you. Thank you so much, Peter. We're really inspired by the work that you've done there. And I think that across California, we're really excited to be seeing the movement that's happening. And so I'm really excited now to invite Cheng Sim Lim to speak with us about the work that they're doing in Los Angeles, which is very exciting and some really great developments there. So Cheng Sim.
Hi, thanks for having me on. We started the campaign in Los Angeles in late May, and basically Public Citizen, Brittany put me together with Sasha Rappaport, and we didn't really know how to start, to be honest. We looked at the materials that was on the website about how to lobby the city council, and for us also the county of Los Angeles. And we thought, well, we don't know anybody, we're nobodies, we don't have any relationships with city council staffers or city council members. Where do we start? And so we, Sasha and I had met for lunch, and we said, oh, well, maybe we start with this neighborhood councils. And because the neighborhood councils for us were the, in a sense, the most accessible entry point to city government. They're the closest geographically elected body. They were set up in the late 90s in Los Angeles at a time when parts of the city wanted to secede. And the city council decided that then they needed to have some sort of mechanism, like a bridge to the city council, to make to encourage civic participation, and also to have the city council feel more accountable to the various neighborhoods and communities. So that's how we started. We thought, okay, let's start with our neighborhood councils. And so we had two we presented that idea to a group of neighbors and friends that we had worked together with on different organizing campaigns. And Dr. Bill was very kind. He came to our first meeting, and the idea to sort of start with the neighborhood councils and then sort of, build the pressure upwards to the city council and then the county was accepted by the group. But we thought also that, the group decided that as collectively, we didn't feel prepared to just go out and lobby. People wanted to get educated on Medicare for All first. So we spent our first two meetings, in the first one in late May, and then the second one in late June, basically having self-teachings. And again, like Dr. Bill was very key. And after the second self-education session was when we sort of started in earnest to approach our neighborhood councils. And also we sort of broadened the participation. I think one of our key leaders, core leaders in the group, Craig Scott, is also on this call. And we sort of divvied up, neighborhood councils based on, where we were constituents or stakeholders. And so, small groups of us went out to make the case for Medicare for All. and asking them to pass resolutions. And long story short, we, last week, so it took us about 2.5 months, and we weren't really sure, how long we would need to do this before there would be action in the city council. We had, so it took about 2.5 months, and it was a circuitous way to get to the city council, but in retrospect, I think turned out to be good. And basically, just about 2 weeks ago, we learned that the president of the Los Angeles City Council introduced a motion to support Medicare for all. And that motion was seconded by 6 city council members. And one city council member whose signature didn't appear in the motion told us a few days afterwards that he actually meant to sign it, but the motion was introduced on Friday, and somehow his signature didn't end up on it. So we technically have, counting the city council president and the 6 plus 1, so 7 council members, we have actually a simple majority already on the 15-member city council board when it comes up for a vote. So, but we were told by a number of city council members that the resolutions from the neighborhood councils was something they took note of. And so, so even, the other, so we were kind of surprised because Craig, who is on this call, noted that, a lot of times these city council motions have 1 or 2 seconders, and this time it was kind of surprising that there were 6, and actually 7 if you didn't count the signature that didn't appear. So it was interesting to us that that the motion was introduced and suddenly it had all the support. And we believe, based on comments that we've heard from city council members that we have been in touch with, that happened because of what we had done with the neighborhood councils passing resolutions. As of yesterday, we have 10 neighborhood councils that have passed resolutions. And so the other sort of unanticipated benefit from going through the neighborhood councils first instead of going directly to the city council is that a lot of us, when we've made our presentations to neighborhood councils, we are learning that we're actually doing grassroots education on Medicare for all. And, there have been a number of occasions when after we share, when we make our presentation, we share our healthcare stories, that the neighborhood council board members end up sharing their own healthcare nightmare stories with us. So it's been quite fascinating, and we feel that we are in a way solidifying the support for the vote that will come in the city council. And we are targeting now neighborhood councils in the city council districts for the members who did not second the motion. And so we have scheduled and are scheduling constituent meetings with our city council members. And we hope, we don't know yet what the schedule is for the vote. In the city council, the motion has to pass to the rules committee. We expect that it will pass the rules committee because 2 of the 3 members of the rules committee already, have endorsed the motion. And so that's where we are.
That's That is fantastic, and I just want to acknowledge just the amazing work that's been done in just a short amount of time with folks who really just got started a few months ago and really dug in. And I think the base building work that's being done in Los Angeles is really exciting and is what this work is about. We also have a lot of really important targets, congressional targets in California. So building the space is really important. We really and I hope others feel really inspired by this as well. Next, I want to turn it over to David McMahon from Norristown, Pennsylvania, who also just recently is coming off of a great victory, a resolutions victory. So if you could give us a quick update, that would be great, David.
Okay. Am I loud enough? Is my volume okay?
Mm-hmm.
Great. Yes. So we began our campaign last January, and on August 20th, Norristown Municipal Council unanimously passed our resolution in support of Medicare for all and affirming healthcare as a human right. I'm a member of Bucksmont DSA. We modeled our campaign initially. We incorporated from a few different areas, but we based a lot of what we did with the Philadelphia DSA branch, Democratic Socialists of America, and incorporated a lot of suggestions from the Medicare resolutions campaign we were all putting together. And it was really helpful, especially in the final drafting of the resolution language. So we are a suburban county of Philadelphia, and Melinda St is our representative in Congress, and she is not yet a co-sponsor of the Millage Eyeballs bill. And so we're using this as leverage to build a pressure campaign on her going forward. That was a big part of getting this together, building a coalition of people in Montgomery County. So in the run-up to this resolution being adopted by Norristown, we just began reaching out in our community, because we started pretty much from zero. We didn't really have contacts with the local council members, so we were really starting with doing all our own groundwork from the beginning, and it sort of paid off. We met with other community groups and sort of explained what Medicare for All was, and sort of developed that education component of it. We gradually, after a little while, had some one-on-one conversations with council members and sort of explained and used kind of like a question and answer period to explain the details of the bill. And there were a lot of questions as to the particulars. So we really had to dig in and educate ourselves on a lot of those details as well. But it has paid off. And then the next steps going forward are to, we've had some contact with some Indivisible and our revolution groups in the run-up to this. And so we're hoping to get them started with their own resolution campaigns in Montgomery County and try to take this town by town, and again, all with the eye towards eventually, pressuring Melinda St to become a co-sponsor of the bill. And so that's kind of where we're at. So although we feel a great relief that we've accomplished this aspect of it, we're going to like what the next steps are, which is basically to help other people begin these resolution campaigns, and then just kind of like town by town, just build grassroots level support for this.
Great.
And but the education, and again, like part of it, I mean, not to go into the too nitty gritty of the detail, but we knocked on hundreds of doors in Norristown, had a lot of one-on-one conversations with our neighbors, and again, it really is about making people aware of what this bill really is, and really push back on some of the ways that people are trying to confuse the issue or scare people who are already on Medicare as if somehow they will be losing something. So developing all these different strategies over this past period from January to August has been a great learning experience, and we look to help other people in our area begin their initiatives as well.
Great, thank you so much. It's really inspiring and wonderful to hear about the victory and the way that you all went about it. And I really want to encourage everyone, no matter where you are in the process, to dig in. And we do have a comprehensive toolkit on our website, step by step. We have the resolution language. We have lots of tools and to help you. Really, thank you. Next, I want to turn it over to Tom Sinsick and Nadine Sambo from Portland, Oregon, who have the Healthcare for All Oregon has been doing wonderful work around resolutions for quite some time. And so we wanted to get a quick update from them. Tom. Oh, did we lose you? I don't see Tom anymore. Nadine, do you want to jump in?
Yeah, I don't see Tom either. Can you hear me?
Yes.
Okay. So this work has been done for a while in Oregon. I'm sorry, Tom had the prepared speech, so I'm gonna apologize. I'm just gonna wing this. But yeah, we've had this organization. They've been around for a while. Resolutions was part of the strategy, I would say like 2 or 3 years ago. Somehow resolutions kind of, you get busy and they had been set aside. So I became the new legislative chair and just knew that that work needed to be picked up again. And then heard you guys saying, hey, come on, you guys need to start doing resolutions. So everything came together really well. Tom's texting me saying his internet went down. So I've been leading the legislative team, and what we've really done is try to tap into our local chapters. So my team itself is very quite small, but we're trying to mobilize that lower level. And we've looked for people that have relationships already established or helping them establish those relationships with their city council. So there were already quite a few passed. We're asking people to actually update their resolutions. And we have a new resolution that was passed in Albany, Oregon. That's our most recent one. That story is very interesting because we actually were not going to even get the opportunity to speak, and the mayor advocated for us to have our time to testify, and we were just going to get shut down. We were not going to be able to talk. I kind of stood up. The mayor advocated for us to be able to speak. There was one fellow who was very concerned about what our senators thought about this. He didn't want to hear it. So fortunately I got time to speak, and I actually went to Jeff Merkley's website, and Jeff Merkley testified for us, and I read from his website, and we ended up flipping his vote, and it became a tie where the mayor was able to pass this resolution for us. So it was pretty fun, I'm not gonna lie. But the most interesting thing about this has been the fact that we actually have resolutions that have been passed and we didn't know about them. So what's coming, that as we're asking people to work on these, that list is getting longer, and kind of stuff's been floating outside of our scope. So now again, refreshing those people, getting those people back together and updating our list. So in Oregon, you see this line, it's our I-5 line. So now what we're really trying to do is get off of that and get out into those smaller communities and help them pass resolutions. But it's been great. So
That's really exciting.
Sorry, like that's all I got.
I can chime in quick.
Oh, there's Tom. Thanks, Tom.
Let me mute this.
Yeah, he's going to talk about we're working with unions.
Yes. Go ahead, Tom, real quick. Thanks.
Okay, yeah. Well, thank you, Nadine, for taking over. I couldn't believe when the internet crashed. I want to thank everybody for the time they're here. And let me get my little note here. Well, basically, we have a thing I can share. We got a site, hcao.org. People can go to that site and look up our resolution strategy. And all the resolutions we've passed, we've got a model resolution up there for people to use. It's hcao.org. And if I can bring it up, can I share screen quick?
Yes, if you go, you can go to the share screen tab at the bottom.
Yep. Share screen. Share. Okay, it should show here, right?
Mm-hmm. Yep.
Okay, you go to Act. It says local resolutions, and you'll see strategy about it. Why do you do that? Who do you need? Where do you go? When do you do it? How do you do it? And some resources, including our current model resolution, Melinda, that I sent to you. That looks like coming up. This. Just something as a model that people can use. So
Great.
in addition, the last part will be, let's see, got that. Sure. We have legislation here, and you can see all the resolutions that we've passed, and we've got them mapped out. Nadine's done a good job of the cities. Some of these weren't resolutions. Some of these were like City of Ashland and City of Corvallis were actual votes, where you got 87% in one city and 75% in another city. So that's another bigger way to go. We also have a resolution by the old Episcopal Diocese, and we are bringing to the AFL-CIO Oregon a resolution now where they're going to go universal health care. And we look forward to having all show up at the National Single Payer Conference here in Portland. So there I am.
Thank you. Thank you so much, Tom. We're so glad you were able to get back on. And we're, the work that's been happening in Oregon was really a model for some of the national work that went into the national Medicare for All Resolutions.org effort. So thank you so much. And we're excited to be working with you. And I think you'll be a great resource to others as well. I want to turn.
Can I say one more thing?
Yeah, we do need to move on.
Sorry. I just want to bring up our map. We've made this interactive map where people have said yes to a commitment and we tag them as yellow. And so people are really enjoying when that flips to green and being able to go there. So just a little fun interactive thing. Thank you.
That's great. I encourage, we'll put you can paste the web address into the chat so people can see that. That would be great. So I want to turn it over to Dominic Harris, who is who's with United Electrical Workers Local 150 in North Carolina. And the United Electrical Workers are a really important partner also in this coalition. And so we're thrilled to be working with labor, and we'd love to hear about an update about the work in North Carolina on Medicare for All. Dominic.
Hey, how you doing? Can you hear me?
Yes.
All right. So we started this a couple of months back. It actually started with 150 so far as what I'm aware of. Actually, IE has been in support of Medicare for All for like the last 40 or 50 years. So that was kind of some of the first people to sign on to it. So what we did was I got active in the union and brought up, because the situation got started around healthcare, or the conversation got started around healthcare, as to how much we're going to pay for it, what we're going to try to get on, and how we're going to try to keep prices down. So I was like, have you guys heard of Medicare for All? Surprisingly, had nobody in the union Charlotte chapter of 150 heard of Medicare for All. So we got to talking about it, shared the information with them. They all got on board. So then we brought it to 150 in Greensboro. So everybody got to talking about it. We got on board. So then we start bringing it up to more members, and educating them. And then we had the Southern Workers School, where we had the longshoremen and National Nurses United. We all came together and came up with a plan to get Medicare for All passed. So this was our plan, to get each one of us would then go into our workplaces and identify 2 to 3 workers that will help us spread information, share information, and reach out into the community. After we reached out into the community and gained community allies, we'll reach out into other workplaces, because the whole idea was to get workers behind Medicare for All. As no workers control the economy. And generally, when you have workers come to you in force and demand something, it usually happens. Even if it doesn't happen the first day, it's the second day. So we all have, so far as the work that we've been doing and the progress that we've made, we have the most recent updates. Let me get to it. So in Goldsboro, they're continuing to pass out flyers in the workplace, and they're getting workers to call in to the NNE National Switchboard. I myself have got about 30 people to sign on a call into that number. I know it was 30 because I sat there while they were calling, and in some cases called the number for them. But they're also in Greensboro. They're doing a show of the Fix It video in the Greensboro Library. In the Longleaf Center, they're setting up educational meetings with members, also working with Reed Street Community Centers to post in the community, and also fundraising to sell plates with fried chicken and putting some Medicare for All spin on that. In the city of Durham, now the city of Durham probably made the most progress because they were pushing this even before our whole local started pushing it. So they actually have a resolution that passed, and that passed in their city council. And but what they need to work on, what they say they need to work on, is more canvassing, starting new canvassing in the community, and getting more information out to employees. And also, they had a Medicare for All People's Assembly at the Hyatt Center in Durham, for the Durham's Workers Assembly. DSA came in, and you were down there, and Healthcare for All. In the city of Greensboro, they're still working inside the workplace. Had a meeting last night. This would have been Tuesday night to continue circulating flyers. City of Charlotte, we're still passing. I'm in Charlotte, so that's my hometown. We're still passing out flyers. We're still getting workers educated. And we actually had a meeting with the mayor, Val Lyles, a couple of months ago, I believe about 2 or 3 months ago in July. She isn't in favor of Medicare for All. Not so, and she basically used a Republican talking point, how we're going to pay for it. So she has to have some education on it. So we agreed. We're probably we're going to have a Southern Worker School where I'm going to catch up on the work that we've been doing. This on the 21st and 22nd of this month. And so it's going to be largely around Medicare for All. We're probably going to invite her and the rest of the members of the city council on down so they can get a full force meeting with Medicare for All and the people who advocated. And also we had our UE convention just last week. I believe it was last week, maybe 2. My time got messed up since I was up there. I think last week, where Bernie Sanders came out and we endorsed him and also passed a Medicare for All resolution for our whole union to start pushing it in our different areas around the nation. And when we endorsed him as candidate, he actually put out a video, video with us endorsing him. So that dispels the whole myth of, unions don't want to have Medicare for All because it's going to take away from the health care that they fought for. So we've been making strides in different areas, some more than others, and a lot of the educational material that we developed came from guys like you, National Nurses United, and Physicians of National Healthcare. They have a set unit here, it's called Healthcare Justice. I do a lot of work with them. They did a phone bank about a few weeks ago. So a couple of us made it down in that. We did some phone bank. It's got about 400 Texas out in the world. So that was me. I don't know how much everybody else got, but I guess all together got maybe 1 million, just to embellish on it. So we're going to start pushing more with community allies and try to vitalize and city council again. We have one person on city council that I know is behind Medicare for All. That's Dimples Ash Mayor. So, and the other guys are they really don't know about it, or they're playing their political chess. So we're going to flip them. I got a good feeling we're going to flip them. That's the work we've been doing.
Thank you, Dominic. It's so wonderful to have labor doing this work, and I think what you said is critical, because there is this misinformation campaign out there about labor not not being on board. And so it's really powerful to have your voice there. And thank you for all the organizing that you're doing in North Carolina. Thanks so much. We are running short on time, and unfortunately, I'm sorry that Representative Dingell seems to have been pulled into something. You know, it's hard with Congress people. They get, and so we'll get a statement from her, and we'll definitely circulate that. But before we end, I want to turn it over to my colleague Brittany Shannahan from Public Citizen, who's been doing a lot of the organizing around the resolutions, to talk about this to introduce the idea of the week of action. And I want to get everyone thinking about that now. So Brittany, please.
Great. Hey, everybody. We're almost done, but not done yet. So I'm going to give a quick spiel because got something I'm super excited about and burn myself out and then go straight to bed. All right. So everyone here is part of a national coordinated effort to win Medicare for all through passing city and county resolutions. And I'm thrilled to announce a week of action that will take place from October 28th to November 3rd. We're hoping to get a lot of city and county council resolutions passed around this week, and we have some great ideas on how we can work together to make that happen around the country. So the idea is to coordinate a series of actions from postcard parties to petitions and public events across the country, and to harness our collective energy to move our city and county governments to pass resolutions in support of Medicare for all. Wherever you are in your resolution effort, from just getting started to working with your council member to introduce your resolution, to the post-victory afterglow from a resolution already passed, everybody will be able to participate. It's time for all of us to work together to raise visibility at a national level to the grassroots leadership that is being demonstrated by local activists around the country, as all of us continue to pass resolutions and to propel the cause of Medicare for all. So we are now sharing a link to sign up to learn more about the week of action, and we will also send it to you by email after the call. We'll be putting together a list of activities that you can choose from to accelerate your effort towards a resolution in your community. So we've got big plans ahead this Halloween season, and I look forward to striking fear into the hearts of insurance and the pharmaceutical power brokers along with you.
Great. Thanks so much, Brittany. And I just want to underline the importance of this. We have been making great strides, and as I mentioned at the beginning of the call, we have 180 efforts going around the country, and those are just the ones we know about. And like the folks in Oregon were saying, there are some that we are just finding out about as they go, which is really exciting. This is a very decentralized movement, but we want to add to that map, and we want to move along in that map so that we really are getting to a big push at once around these resolutions. So we will have kind of a checklist that, for folks to get engaged. So we're coming to the end of our time, and again, I will follow up with Congresswoman Dingell. I know she was really excited to be here with all of us, so we will make sure to have her on an upcoming webinar as well. And thanks to everyone who wrote into the chat.
Sorry, Melinda, don't we have Dr. Bill coming on?
Yes, we do. Yeah.
Okay.
Yeah. No, thank you. So I want Dr. Bill Honigman from Progressive Democrats of America. If you want to give a quick shout out announcement, PDA does amazing work with us, and you have an upcoming webinar. So
yes, and especially featuring your work, Public Citizens' work with our own PDA's Donna Smith. We have our monthly issue team call. If you go to Facebook, PDA Healthcare. And that's Progressive Democrats of America, as well as People Demanding Action. That's our issue side of PDA. Just go to PDA Healthcare for the event page and sign up. I don't have the Zoom link for you just yet, but we'll have that before the meeting. It's Wednesday, September 11th. Oh boy, September. I guess that's better than Friday the 13th, right? But we have planned Donna Smith, our own Donna Smith from the movie Sicko, the Michael Morris movie Sicko. She'll be on the call with us, and she's working on a program with Egan of Public Citizen on the communications piece for waste, fraud, and abuse in healthcare. So we're looking forward to that. And we're also working on getting the former premier of Saskatchewan, which is, of course, like governor in our country, who did a tremendous amount of work on the transition from private to public Medicare in Canada. And his name is Roy Romanoff. So we expect them as our guests on our call on Wednesday. Thank you so much, Brittany and Melinda, and all the great work that everybody's doing out there.
Yes, thank you. And thanks, Dr. Bill, and to PDA. So much of the local resolutions efforts are happening by local PDA activists and many other members of the coalition as well. And so I want to, the other thing I wanted to say right before we close, I know we're toward the end of our time, but as in the coalition, we were discussing the importance of supporting of solidarity across movements. And I'm sure folks are well aware of the climate strike that's coming up on September 20th. And we recognize the importance for our movements to show up in solidarity with one another. And so especially because we know there's no question that the climate crisis was also going to be a massive health crisis and a massive health care crisis. So we want to note that and to encourage folks to show up for each other, the intersections between our movements, and to help make some of those connections between healthcare and climate. So I just wanted to voice that, and once again to encourage folks to sign up for, if you want to learn more about the Week of Action, we'll be telling you more about that in the coming weeks. Our next webinar is going to be on October 2nd, so look out for that. You can mark your calendar, and we will be building up toward the end of October. We will also be presenting about the resolutions at the single payer conference that was mentioned in Portland, so we hope to see many of you there. And if you want to present the activism and the work that you're doing on one of these webinars, please let us know. Tell Brittany, tell me, and we will. We'd love to highlight the local work that's extremely important. And once again, thanks to everybody for joining us and for being part of this movement. I really believe the momentum is growing, and we're going to win this. So I'm glad to be fighting alongside all of you. Thank you so much.